intent of this video is to help both the addict and the loved one who's concerned about the addict to have a better understanding of the general process that's involved at one of the many drug and alcohol treatment centers. If you have never been in a residential rehab program, you may have some misconceptions about what takes place at one of these facilities. It is important to understand that you are not a prisoner at a residential rehab. There aren't locks on the exits. In fact, you are free to leave anytime you want. Now, if you've been remanded to a treatment program by the legal system, you can still walk out, though there may be repercussions for doing so at a later time. Why aren't there locks? It's because your success in one of the drug and alcohol treatment centers is dependent on your wanting to be there and your willingness to get clean. Don't waste your time and money if you're simply going through the motions and knowing that you'll drink and use again once you leave the program. So what happens if you're committed and decide to stay? Often, the first step in this journey is detox. While some drug and alcohol treatment centers have their own detox program, more often than not, a residential rehab will require you to finish detoxification before you begin their treatment. Generally, a good rehab facility will have a working relationship with a quality detox center and can therefore refer you directly to that program, with the understanding that you will be entering the rehab center when you're ready. Detox programs will usually have you go through the drug and alcohol withdrawal at a facility that focuses on this particular issue. Withdrawal symptoms can be severe, and so it is very important that it be done on a closely supervised inpatient basis. Detox typically will last 5 to 7 days, but sometimes longer. Now let's talk about the drug and alcohol treatment centers themselves. There are thousands of residential treatment centers in the U.S., and every one of them is unique as far as their physical facilities are concerned. They can range from the most simple camp-like settings in an outdoor or wilderness program to a high-end program with 5-star chefs and accommodations. Where you go has a lot to do with whether or not you have insurance or what you can afford. That being said, a program that's in the low to middle price range might be just as or more effective than a high-end treatment center. What's more important is the quality of the program in helping you stay clean, not the price. One of the main components of all good rehab programs is education. Now, education will often vary from program to program, but the ultimate goal is to get you to honestly look at your addiction from a realistic point of view, and to help you develop new attitudes about your use of drugs and alcohol. While in early recovery, most addicts and alcoholics are in a significant state of denial about their disease. You may still hold on to the belief that you can simply quit at any time, and therefore are somewhat ambivalent about getting clean for good. A good treatment program will attempt to help you break this cycle of thinking, and then help you get on board with a commitment to stay clean and sober for life. You will also learn about the nature of alcoholism and drug addiction, as well as the effects continued use will likely have on your physical, mental, and social life. Let's cover counseling and group therapy now. While at a drug and alcohol treatment center, you will likely receive individual counseling with someone who specializes in addictions. In most cases, you will also participate in group sessions several times each week. The purpose of these therapy sessions is to help you better understand your addiction while teaching you skills that you'll need to live in the world without using alcohol and drugs. You will likely learn about things that can trigger your desire to use, and how to recognize and avoid the situations most likely to cause you to use these substances. You will learn coping skills. Group therapy will teach you the value of peer support. It is very important to engage with others who are experiencing the same challenges as you. Many quality programs use the actual 12 steps of recovery as their foundation, and then have staff-facilitated sessions as well. Now let's move on to neurofeedback in addiction treatment. One of the most powerful uses of technology in the area of addiction treatment and relapse prevention is called neurofeedback. More and more great treatment programs are now utilizing neurofeedback as part of their regular regimen. Neurofeedback, or EEG biofeedback, is a completely non-invasive way that the addict can begin to retrain and regulate their brain in order to better deal with their disease. Neurofeedback gives the client a remarkable edge in relapse prevention and long-term recovery. The latest study through UCLA in 2006 resulted in a 77% success rate in recovery 1 year post-treatment. This outcome is far superior to the dismal success rates rehab centers were experiencing before the use of neurofeedback. The question of whether or not a treatment center uses neurofeedback should definitely be asked before committing to a program. Another important element of good programs are family meetings. Successful drug and alcohol treatment centers will often include family meetings and interactions as part of the recovery process. Research confirms that including family and often friends in your addiction treatment can ultimately improve the success of your recovery. Members of your family will also learn about the disease of addiction. They'll see how they can best help and encourage you in your recovery process. Part of this process also involves the discussion of how they have been affected by your addiction and how they can address their own hurts and frustrations. Often, a treatment center will have family members attend Al-Anon meetings before they can visit you at the recovery center. Al-Anon can help them understand how they might have been contributing to or enabling your addiction because of their actions. What happens after treatment should be a good quality aftercare program. Commonly, a long-term drug and alcohol rehab program will last anywhere from 3 to 6 months. While at one of the drug and alcohol treatment centers, you will be in a structured and clean environment. When that program is over, then what? It can be a little frightening to have to transition from the safety of a treatment center back into the real world. A good rehabilitation program will also have a good aftercare program to help you reintegrate into society while staying clean and sober. There are a variety of aftercare programs available, and your counselor will be able to help you decide what's the best fit for you. The aftercare may include a variety of things, such as staying at a sober living facility, attending 12-step meetings, drug testing, weekly check-ins with your counselor, education, job search, and more. All with the goal of helping you avoid the triggers and situations that may cause a relapse so that you can be successful in recovery. Now that you are a little better informed about drug and alcohol treatment, I would like to offer a suggestion.